The next important topic is conditions or causes for hypercholesterolemia. Actually, you should carefully read about the questions. We have two types of questions. One is hyperlipidemias. That means Fredrickson's classification of hyperlipoproteinemia. That is different. Another question is simply cholesterol, hypercholesterolemia. So, what are all the causes for hypercholesterolemia? Okay, we have 4 or 5 conditions which will produce hypercholesterolemia, right? The number one is diabetes mellitus. You know, diabetes mellitus means hyperglycemia. Hyperglycemia means the plenty of glucose is available. This glucose is converted into pyruvate and then acetyl-CoA. Because of the deficit of the oxaloacetate, this pyruvate and acetyl-CoA is not enters into the TCA cycle. They will go for excess cholesterol synthesis. That is, acetyl-CoA enters into cholesterol synthetic pathway. Okay, the routine TCA cycle will be blocked. That is why in diabetes mellitus hypercholesterolemia will be there. Second one is obstructive jaundice. This is very simple. There is some obstruction in the bile duct which increases the cholesterol. That prevents the excretion of the cholesterol. Excretion of bile through bile duct is blocked. The examples are gallstones or some tumors in the bladder, prostatic tumor like that. Third one is thyroid gland, hypothyroidism. This is very, very important. Actually, the thyroid hormones are very important for the cholesterol metabolism as well as cholesterol clearance. Suppose the decreased hormones of thyroid, that is hypothyroidism, we will get increased level of LDL cholesterol. The liver is having the ability to remove LDL cholesterol, right? In this scenario, this is reduced due to decreased activity of LDL receptor. For LDL metabolism, already we know LDL receptors are very, very important for the transportation of LDL metabolism. So, decreased LDL receptor leads to increased amount of LDL cholesterol in blood, and finally, we will get hypercholesterolemia. This is for hypothyroidism. The next one is nephrotic syndrome. Some problem in the kidney, increased protein loss will be there. That is albuminuria or proteinuria. We knew the albumin is for the transportation of the free fatty acids or fatty acid compounds. So, the loss of protein in urine means the LDL cholesterol and total cholesterol amount is elevated. That leads to increased production and decreased breakdown of cholesterol, ultimately leads to hypercholesterolemia, right? And the last one is familial hyperlipoproteinemia. We are having 4 or 5 types. In these 5, 2A, 2B and 3. Don't forget 2A, 2B and 3. These 3 types are having increased cholesterol, that is hypercholesterolemia. This is for your short notes as well as MCQ. In MCQ, you have to be very carefully rolled out. One important number one world's disease, diabetes mellitus. Number 2, liver disease, obstructive jaundice. Third one is kidney disease, nephrotic syndrome. Fourth one is thyroid disease, hypothyroidism. Number 5, hyperlipoproteinemia. That is 2A, 2B and 3. These are all the conditions for hypercholesterolemia. Okay.